Okay, so today's topic is brachial plexus. So, what is a brachial plexus? Now, as you see the definition being written down here, the brachial plexus is a somatic plexus and it is formed by the anterior rami of C5 to C8 and most of the anterior ramus of T1. So, what they're basically saying here, what's the meaning of somatic? Somatic means anything which is related to the body or soma. Okay, so again, read the definition. A brachial plexus is a somatic plexus. I hope you got the meaning of it, and it's formed by the anterior rami, which also means roots. So it's formed by the roots of C5 to C8 and also the roots of T1. Now, most of the times, most students have no idea of where the brachial plexus originates. Brachial plexus originates in the neck and it passes laterally and inferiorly over the first rib and then enters the axilla. The course of brachial plexus has to be known because it's very important when we have to learn the injuries regarding it, the branches it gives, the supply, where all it supplies. So the course is kind of important. Okay, so again I repeat that it's formed by the root of C5 to C8 and root of T1, and that it originates in the neck and then it passes laterally and inferiorly over the first rib and enters the axilla. Now, brachial plexus, so this is a plexus as we told, right? A somatic plexus. There are five important components for this plexus. The first one being the root, the second the trunk. The trunks go on to form the division. These divisions unite to form cords, and cords will give out their terminal branches or nerves. Okay, so these are the five components of it. Next. Now, as we see over here, this is basically the diagram of brachial plexus. Okay, now you see the roots. The roots, notice that union of C5 and C6 roots go on to form the superior trunk, and the superior trunk gives rise to an anterior division and a posterior division. Okay, now we'll stop till there and we'll explain the entire thing later. So C7 continues as the middle trunk. Okay, so it does not unite with any other roots. C7 as such continues as the middle one. C8 and T1 joins to form the inferior trunk. Okay, now these three trunks, as you notice, has given out an anterior posterior division. Now the middle one, you notice there's an anterior posterior division, and the inferior one also has an anterior and a posterior division. Now, why are we saying about these divisions is that these divisions unite to form the lateral cord, the posterior cord, and the medial cord. Okay, now we have three anterior divisions, right? From each trunk we have one anterior division each. So there are three anterior divisions. The anterior division of the superior trunk and the anterior division of the middle trunk will form the lateral cord. Okay, so anterior division from superior and middle trunk forms the lateral cord. Now we're coming to the posterior cord. Now before we come to the posterior cord, just notice that there is one anterior division left out of the three, right? So that is of the inferior trunk. Inferior trunk's anterior division goes on or continues to form the medial cord. Okay, so medial cord is formed by one anterior division of the inferior trunk, and lateral cord is formed by two anterior divisions, one from the superior trunk, one from the middle trunk. The posterior cord is formed by three posterior divisions of all the three trunks. You notice the posterior cord is formed by the posterior division of the superior trunk, the posterior division of the middle trunk, and the posterior division of the inferior trunk. Okay, and now these three cords go on to give rise their respective terminal nerves, which will come in the following slides. Now here, this is a picture that I basically took just to point out to one certain point. See here, if you notice, there is the things in yellow color, right? So this yellow thing is basically the cervical sympathetic ganglion that you see. So this cervical sympathetic ganglion, you see that from the superior, middle and inferior cervical sympathetic ganglion, there are certain purple colored fibers that you see in the diagram, and these purple colored fibers are going on to the roots and they're carried further. So what are those purple color fibers called? They're called as gray ramus communicants. Okay, so I mean it's not literally purple in color, I'm just saying it from the diagram. So gray ramus communicants will go on to the roots. So, and they come from the cervical sympathetic ganglion. Now we are basically going to say about the roots. As I said earlier, you know that the brachial plexus is formed by the roots of C5 to C8 and also the root of T1, and they receive gray rami communicants from the cervical sympathetic ganglion. Now we need to know, now when we told that the brachial plexus goes right from the neck to the axilla, we told about it. So we need to know where the position of the root exactly is. So we know root will be certainly in the neck. So it enters the posterior triangle of neck by passing between the anterior scalene and the middle scalene muscles, and they lie superior and posterior to the subclavian artery. So I hope that is clear. That's their position, and this is how they enter the posterior triangle of the neck. Now, before these roots unite and form the superior, middle and the inferior trunk, before they do that, there is two branches from the roots, and similarly there are two branches from the trunk that go as well. So two branches from the root is the dorsal scapular nerve and the long thoracic nerve. So dorsal scapular nerve only originates from C5, whereas from C5 to C7 the long thoracic nerve originates. Dorsal scapular nerve supplies rhomboids major and minor, whereas long thoracic nerve supplies specifically the serratus anterior muscle. Okay, so now we have the trunks. As we told, these trunks, now we have to know the position of the trunks. We told the roots were situated, they enter the posterior triangle of neck, and they are lying posterior to the subclavian artery. So now where does the trunk lie? The trunk passes laterally over the first rib, and then they enter the axilla. Okay, so trunk, as we told, the union of C5, C6 produces the superior trunk, union of C8 and T1 produces the inferior trunk, and the continuation of C7 produces the middle trunk. Now branches of the trunks. We told, as I stated earlier, there were two branches from the roots. Now there are two branches from the trunk, and both these branches arise from the superior trunk. There are no other branches for the inferior or the middle trunk. Okay, so there are two branches from the superior trunk, one being the nerve to subclavius and one being the suprascapular nerve. The suprascapular nerve will supply the supraspinatus and the infraspinatus muscles, and of course the nerve to subclavius supplies the subclavius muscle. Now coming to the divisions, we told every single trunk, okay, divides into an anterior and posterior division. Now why we're telling this here is that all the three anterior divisions, okay, they give rise to peripheral nerves which are going to be associated with the anterior compartment of arm and forearm. So just how you could remember is anterior division is associated with the anterior compartment of arm and forearm, and similarly the posterior division will be associated, or they give rise to peripheral nerves which are going to be associated with the posterior compartment of arm. Now codes, we told there were three codes: the lateral code, the middle code, medial code and the posterior code. Okay, and I told earlier about its formation. Now here the only important point to be noted is that lateral code will be lateral to the second part of axillary artery, whereas the medial code will be medial to the second part of axillary artery, and posterior code will be posterior to the second part of axillary artery. So that's how the codes are positioned. And now we have the picture once again, which I will be telling fast to give you a quick explanation. Okay, so you notice the roots. There are two branches from the roots, dorsal scapular nerve and also the long thoracic nerve going from C5, C6 and C7, and the dorsal scapular nerve goes from C5. Okay, union of C5, C6, superior trunk. Superior trunk gives rise to two branches, suprascapular nerve and nerve to subclavius. Next one, C7 root continues as the middle trunk. C8 and T1 roots join together to form the inferior trunk. Okay, now the superior trunk and the middle and inferior trunk all divide into anterior and posterior divisions. Anterior division of superior and the middle trunk forms the lateral code, and anterior division of the inferior trunk continues as the medial code. Posterior division of all the three trunks give rise to the posterior code. Now the lateral code is going to give out certain branches, right? Terminal nerves. So as you see here, one terminal nerve is the lateral pectoral nerve, one is the musculocutaneous nerve, and one is the lateral root of median nerve. Median nerve has a lateral root and a medial root. Okay, so lateral code is giving rise to three branches: lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. The posterior cord is going to give rise to 5 branches. 3 branches you could see here. Okay, they are superior subscapular nerve, inferior subscapular nerve, thoracodorsal nerve, then axillary nerve and radial nerve. Okay, so that is the total 5 branches. The medial cord gives rise to another 5 branches. One is the medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, ulnar nerve and medial root of median nerve. Okay, so this slide will show us what cord gives rise to which branches. Lateral cord, 3 branches: lateral pectoral nerve, musculocutaneous nerve, lateral root of median nerve. Medial cord gives rise to another 5 branches: medial pectoral nerve, medial cutaneous nerve of arm and medial cutaneous nerve of forearm with medial root of median nerve and ulnar nerve. So posterior cord gives rise to the radial nerve, the axillary nerve, the inferior subscapular, superior subscapular nerve and thoracodorsal nerve. Now here the important points I'll be just stating is, you know that the brachial plexus has roots, trunks, cords and divisions, right? So there can be damage to the roots. And how does damage to the roots occur? If there is spinal cord injury in the cervical region, okay, and if there is direct pulling injury, okay, so we told that the roots are in the neck. So any injury in the cervical region, spinal injury, direct pulling injuries, they'll cause damage to the roots. Trunks, we said, passes laterally over the first rib and enters the axilla. So any injury that occurs to the first rib will cause an injury to the trunks of brachial plexus. Now we told about the cords and the divisions, right? So any injury that occurs to the shoulder joint, like let it be a dislocation of the shoulder joint or a fracture, it can lead to injury of the divisions and cords. Now here there are 2 injuries that we need to focus on of brachial plexus, which is most commonly asked related to it: ERB'S palsy and KLUMPKE'S paralysis. So first, ERB'S palsy. Now the main point that you need to know about ERB'S palsy, the first thing is it occurs because of a damage to the C5 and C6 root. And how is it caused? It's caused by excessively pulling, twisting or pushing the baby's head during the delivery, or because of a shoulder dystocia. Okay, so that's a cause. Now I'll show you a picture. If you see, these are the features of ERB'S palsy. This is how the kid looks. If you notice closely, they are going to have Horner's syndrome, where they have ptosis as well as a very small pupil, and they'll have bird winging of scapula. Other features would be a forwardly rotated shoulder, upper arm redness, muscles being atrophied in the arm with a diminished arm length, and the most important one, the weighted tip deformity. So these are the features of ERB'S palsy, the most important being the weighted tip deformity, Horner's syndrome, bird winging of scapula. Now KLUMPKE'S paralysis. KLUMPKE'S paralysis is occurring because of a damage to the C8 and T1 roots. ERB'S occurred because of damage to C5, C6, and KLUMPKE'S occurs because of damage to the C8 and T1 roots. Okay, so the highlight of KLUMPKE'S paralysis is that the person has a claw hand deformity. Claw hand deformity means the wrist and the forearm. The forearm is going to be supinated, and the wrist and the fingers will be hyperextended. Now there will be flexion at 2 points, the interphalangeal joint and the metacarpophalangeal joints. So that is, basically how a claw looks, right? So you'll have a claw-like hand deformity, and all the intrinsic muscles of the hand and flexors of the wrist and fingers are being affected in KLUMPKE'S paralysis. So this is the picture that you see. The child is going to have severe limb atrophy, and the person has a claw-like hand. So this is basically all that I have to say about brachial plexus, and thank you for your attention.